The aim of this presentation is to increase awareness of low workplace morale, the way in which it impacts us as nurses, the impacts it has upon our patients we are treating, and the strategies we may use to alleviate this issue if it were to arise within our practice. Nursing morale may be described as the tone of attitudes, culture, standards, beliefs, and values and emotions felt by employees, which directly influence behaviour and task performance. A nurse's degree of performance and attitude toward deliverance greatly impacts upon patient care and outcomes. To understand the extent this topic raises within everyday healthcare practices, it is firstly important to appreciate just what nurses do. Nurses save lives, alleviate suffering, advocate for the vulnerable, protect against illness, and enable the weak. Nurses hold hospitals together. From the contributions of personal health to the social and economic attributes of the serving societies cannot be underestimated. To have these contributions compromised results at a loss for worldwide health and well-being. Nursing is the largest health profession in the world, thus the work by nurses is of paramount importance to each encountered individual's health. Health services in Australia are failing to acknowledge the contributions of nurses, which see avoidable deaths, illness, reduced quality of care and injury to patients as a result. Systemic failures such as leadership facilitating an unhealthy culture and a low workplace morale being of influence. A work environment which is seen to be unhealthy or of low morale saw a 23% increase in nursing burnout affected by inadequate support, decreased job satisfaction, and an increase of errors made. Morale within nursing is low and continues to decline, with nurses feeling little professional contentment, feeling of little value to the health system, and lacking systemic support. Improving a nursing environment directly improves patient healthcare outcomes by diminishing errors and adverse outcomes. Errors made within health facilities carry deep consequences. A publication from the US Department of Health and Human Services in 2003 detailed evidence of implications between working conditions, patient safety, and patient outcomes in an attempt to understand just how working conditions added to approximately 44,000 to 98,000 deaths in the United States as a result of medical errors. Australian healthcare settings are pushing nursing workload and job responsibility to a crucial point where it is daily seen an approximated 50 deaths and 140 cases of permanent injury as a result of the poor healthcare received. Thus, it is of urgency that high quality and safe healthcare is ensured, with nurses being key to achieving this. Nurses carry the responsibility of delivering patient care that is safe and effective. To ensure nurses are functioning at their optimal level, management has the responsibility of reducing detrimental components that impact upon job performance, as well as staff physical and mental health. Mitigating bullying from the workplace may be necessary to create and maintain a high-performing, caring, and safe hospital culture to ensure nurses are functioning at their optimal level. A study was conducted for the purpose of investigating workplace morale and job satisfaction amongst nurses within hospital units. The findings published morale on the unit was subject to supervisor support, recognition, and imposed pressure. Personal morale was credited by recognition again. This illustrates the strong influence a supervisor has upon each individual as well as our hospitals. A quality research paper found 4 major themes in what healthcare providers contributed to low workplace morale. These were communication, management's influence, inadequate staffing, and intrinsic stresses. Within recent times, implications upon patients and nurses stemmed from low workplace morale has been subject to a vast number of government, independent, and organisational reviews. Extensive contributing factors were identified, and in response, various hopeful solutions were implemented. After reading through many reports, reviews, and studies, the nursing workforce evidences little benefit from initiations, primary breakdowns in nursing, education, and training, skill inadequacies, and workplace environments in which are neither enjoyable, healthy, or safe. Today, it is acknowledged that extensive solutions are required and an attempt to improve upon this issue. Low workplace and nursing morale is a significant issue in contemporary nursing practice as it impacts upon patient life, which in itself is possibly the most significant of issues. An international study was conducted and published by the University of Queensland to determine just how important the nursing practice environment was to both individuals' outcome and patient outcomes. Strong evidence was found that the workplace environment was a responsible variable for outcomes. Such suggestion commands high workplace morale be further prioritised in our hospital. This year, 2019, Nurses and Midwives Association conducted a review of New South Wales hospitals, citing significant ongoing problems. Violence and aggression, attacks toward nursing staff is a common and recurring headline in recent times. Published the post-incident responses from workplace leaders, which included downplaying the event and lacking in empathy toward the staff. 2/3 of nurses reported management did not support nor offer support services or follow-up post-event. Sadly, 11% of participants in the study were blamed by management for being attacked by a patient. These professional responses resulted with participants displaying reduced quality in their patient care, avoiding patients, lower morale, and lacking empathy toward patients. Low workplace and nursing morale are widely and locally prevalent, with serious implications as a result. These issues can and need to be corrected. Workplace morale, more often than not, stems from the type of leadership within. An influencing leader has great significance by establishing standards of morale in either a toxic or productive manner. This source of influence directly places the leadership at hand as effective in mitigation of low workplace morale. Effective leadership can alleviate this issue in acts such as engaging with staff in a kind and caring manner, as this strengthens interpersonal relationships, building trust, and enhances a sense of self-esteem. Providing positive and constructive feedback along with encouragement to nursing staff is an act which can be practiced regularly, quickly, and requires minimal effort, leaving a lasting positive effect on the receiver. Appreciation is a key to increasing staff morale, with increased productivity and staff retention. Adding those employees who do not feel appreciated or recognised by their leader are twice as likely to leave within 12 months. Leadership acts enable the promotion of a healthy work environment, which importantly see patient care outcomes increased. As leadership influences workplace morale, the tone of morale also holds implications upon leadership and professional practice. Contemporary literature states staff absenteeism, high staff turnover, high incident rates, and staff compromise attitudes cause interference with a leader's ability for production, as their efforts are redirected to rectifying preventable issues caused by the staff. Consequently, this contributes to decreased patient care, as the facility is focused upon rectifying management issues opposed to patient care. Our responsibilities going ahead as future registered nurses are to practice within the relevant New South Wales health guidelines by implementing the relevant policies which are aimed at amplifying the deliverance of nursing care. The NMBA lists professional guidelines in which nurses are obliged to honour. The New South Wales Nurses and Midwives Association acknowledges research that proves a link between nursing staffing levels and skills mix and the production of safe and healthy quality care. So there are guidelines that nurses must oblige to with that, such as providing information and education required to enhancing people's control over their health. APRA also published domains in which nurses to be responsibly adherent to. These domains aim for promotion of a healthy workplace, valuing inter-staff relationships, and engaging evidence-based practice. APRA published subject relevant guidelines in which each nurse is obliged with due responsibility to provide education and assessment in following nurses which aim at workforce progression. There are relevant guidelines which adhere to teaching and supervising, which is our responsibility to teach fellow nurses. To finish this topic, I'd like to quote Richard Branson. He may bear little relevance within health, however, as this is subject to leadership, Mr. Branson is one of the most successful and innovative of leaders worldwide, who credits his success of his business to maintaining and stimulating high staff and workplace morale. Quote, "Clients do not come first, employees come first. If you take care of your employees, they will take care of your clients." End quote. Mr. Branson believes taking care of your employees, as a result, they will take care of your business. Factually, hospitals are indeed businesses that need the admitting clients taken care of with the utmost emphasis, solidifying the relevance of these quotes. Quote, "Train people well enough so they can leave, treat them well enough so they do not want to." End quote. The manner in which staff are trained and treated are key to workplace morale, proven paramount in success of the Australian healthcare.